For Works, we've worked to dramatically scale up our testing capacity, and that's because we believe testing is crucial not only to our current efforts to understand and slow the spread of this disease, but because it will play a critical role over the long term as we work through decisions around reopening parts of our community. We're continuing to make progress, and as of yesterday, we've conducted a total of 126,551 tests. This includes a new 4,500 tests conducted yesterday, which were conducted at 28 sites across the Commonwealth, including public and private labs. This makes Massachusetts one of the leading states in the country with respect to testing. We're grateful to our colleagues in the life science and medical community, whose laboratories are a big part of Massachusetts' progress on this front. That includes partners like Quest Diagnostics, the Broad Institute, and many other public and private sector hospitals. Their contributions and the partnerships are another example of how Massachusetts' existing nation-leading healthcare and innovation leaders are helping us respond to this unprecedented outbreak. In Massachusetts, we also launched initiatives to test our most vulnerable residents, like our seniors living in long-term care facilities and individuals with developmental disabilities. Testing is crucial for a number of reasons, but most of all, it gives us the opportunity to identify and then isolate people who have tested positive and to make sure they get treatment. It helps us understand where the outbreaks are and to keep people informed with respect to infection, even if they don't have symptoms, to slow the spread in the short term. This data is also going to be crucial to plug into contact tracing, which is ultimately the infrastructure that we believe we need to build here in the Commonwealth alongside our colleagues at Partners in Health to ensure we can do everything possible to identify and isolate people who are dealing with COVID-19 after the surge and beyond. We're working around the clock to obtain and distribute large quantities of personal protective equipment to support frontline workers, and the Command Center, working with state and local partners, has helped distribute over 3.7 million pieces of PPE to hospitals, nursing homes, community health centers, public safety personnel, local boards of health, and state agencies. This includes over 2 million gloves, over 820,000 masks, over 370,000 masks from the aircraft delivery, and over 170,000 gowns. Late last night, another portion of the aircraft mask shipment arrived here in Massachusetts, and in addition to that, FEMA notified us this morning that we'll be receiving 1 million pieces of personal protective equipment, including 650,000 masks and 260,000 Tyvek suits. State officials are in the process of inspecting and counting all this inventory, and MEMA will work quickly to distribute these much-needed gear to our frontline workers once the inventory count and the inspection is completed. And as I've said many times before, I'm incredibly grateful for the generosity and support of the Kraft family who helped us bring that shipment home. Getting enough gear, not just here in Massachusetts, but across the country, has been a challenge and will continue to be until supply chains adjust to the new normal on this. And as we announced yesterday, we're posting a daily summary of personal protective equipment distribution, which is available at mass.gov/COVID-19. For several weeks now, you've heard us talk about the work that's been done with the Command Center and our healthcare community to determine exactly what the plan and the bed capacity that we need here in Massachusetts to manage our way through the surge. That plan includes an entirely new system to track bed capacity on a daily basis. Those stats are now posted publicly. As of the end of the day Monday, there were 17,500 beds statewide in Massachusetts that were suitable for COVID-19 treatment. That includes just under 6,000 acute care beds, just over 2,500 ICU beds, and approximately another 750 beds that are available in the field hospitals that we've put up for patients if needed. The last number will increase as we bring more field hospitals online. Yesterday, Lieutenant Governor Polito and I visited the new field hospital at Joint Base Cape Cod that will formally launch on Monday. Additional sites are being launched in Lowell and down in Dartmouth on the South Coast to ensure we sustain a regional approach to these field hospitals. Those 3 sites join the 2 that are already open, one at the DCU Center in Worcester and the other at the BCEC in Boston. The beds in these facilities will serve as an alternative care option for medical professionals to treat patients, especially those who need less intensive care. They also leverage partnerships with local healthcare providers who know their communities and their populations well. These sites would not be possible without the coordination between the National Guard, MEMA, our command center, and many of our colleagues in the healthcare community who have stepped up in a big way to make this possible and to get it done in a very short period of time. Right now, the number of patients at the 2 sites that are open is relatively low, just a handful, but these sites are being built to augment existing hospital capacity, and we hope the surge in cases is not significant enough that we'll need to rely heavily on those beds. But we think it's important that they be there and that we have them, because all along the goal has been to plan for the worst, and that's exactly what we've been doing. I'd also like to do an update today on our strategy with respect to long-term care facilities. Massachusetts is working to detect, prevent, and manage the outbreaks of COVID-19 throughout the state, and we are intensely focused on mitigating the spread of illness in our senior living facilities. In total, there are 383 nursing homes in Massachusetts, 255 assisted living residences, and 93 rest homes. There are approximately 38,000 residents in nursing homes, 16,500 residents in assisted living facilities, and approximately 3,000 residents in rest homes. As we've all discussed before, these facilities, not just here in Massachusetts, but everywhere, are highly vulnerable settings for outbreaks of COVID-19. That's why we were among the first states in the country to implement stringent visitation restrictions and screening guidelines for staff. To protect the health and safety of our most vulnerable seniors and the dedicated staff who support their daily needs, we've continued to build a multi-pronged approach to respond to COVID-19 at these facilities. Our strategy includes expanded mobile testing. We are one of a very small number of states that have brought testing to our senior care facilities so that that work can be done on site. Personal protective equipment distribution, rapid response clinical teams and other staff resources, crisis management support, $130 million in new funding, and a nursing home family resource line. Secretary Sutters will talk a little bit more about that in a minute. We've talked before about expanding our mobile testing program, working with our colleagues at the Department of Public Health and the National Guard to support long-term care facilities here in Massachusetts. How this works is rather than having people make a trip to the hospital or to a medical center, the Department of Public Health brings the test to them at their facility. This proactive on-site testing also heightens our visibility into how the virus is impacting these facilities even before facilities in some cases realize that residents are infected. With the data, residents can be quarantined and monitored to slow the spread as much as possible. On April 13th, we updated testing guidance to encourage long-term facilities to conduct widespread testing for residents even if they have no symptoms with residents or with their staff. Facilities can either get tested through the mobile testing program or they can conduct their own on-site testing using kits that we're making available through the Broad Institute. As of April 14th, more than 4,500 tests have been collected at 264 senior living facilities. And as of yesterday, another 77 facilities had requested more than 8,600 test kits from the Broad Institute, and the Broad Institute will process those tests on behalf of those facilities. Nursing facilities have also received a significant distribution of personal protective equipment. Since the beginning of March, we've provided nearly 1.3 million masks, almost 200,000 gowns, and over 2 million gloves. Massachusetts is also mobilizing a rapid response clinical team capability to provide short-term support to facilities with a high volume of cases or with critical staffing needs. These teams are made up of EMS technicians, nurses, and other healthcare professionals. Having these resources available for rapid deployment makes a big difference in the long-term care facility system, and it's something that we have already gotten positive feedback from a number of community providers as a result. The COVID-19 outbreak has undoubtedly put a strain on the staff and the dedicated healthcare workers who take care of many of our most vulnerable seniors. Staff shortages are also more likely to occur in facilities if more employees test positive for COVID-19. To meet staffing needs, our administration has stood up the long-term care portal to match individuals that have registered through the portal with the staffing requests submitted by facilities. We've also announced a $1,000 signing bonus to all individuals that register through that long-term care portal to work for a certain amount of time, and we've tapped into the MA Responds volunteer portal. To provide crisis management support, we've also contracted with a firm that specializes in nursing home crisis management. They'll be available to provide facilities with on-site operational support to assist with staffing, vendors, implementing infection control measures, and other key elements of appropriate operation and design during this time. The firm will also support efforts to stand up dedicated COVID-19 wings or units in existing nursing facilities. I'd also like to say a quick word about nursing facility capacity. We've pursued 3 parallel options for expanding COVID-19 dedicated nursing facility capacity here in Massachusetts. First of all, converting existing occupied facilities to fully dedicated COVID-19 facilities. An example of this would be the Beaumont facility in Worcester. Second, converting empty facilities to stand up a new dedicated COVID-19 nursing facility. An example of this would be the Pioneer Valley Recovery Center in East Longmeadow. And third, creating dedicated COVID-19 wings within a broader nursing facility. We've built this 3-pronged approach to ensure that we have the needed capacity for our seniors and to adapt to the realities of COVID-19 infections that have clearly impacted several facilities. The goal here is to be nimble and smart in our approach, and we believe that these different build-outs provide the appropriate setting for seniors and for staff to get and provide the best care. To date, in addition to the Beaumont facility, the Commonwealth currently has 5 dedicated COVID-19 facilities opening within the next 7 to 10 days in Brewster, Falmouth, New Bedford, East Longmeadow, and Great Barrington, with a couple of others in planning stages. No one's ever done this before. The Command Center pulled this together using every available resource and will continue to adapt and respond to the situation as it requires.